Dr. Gaurav Gupta. He is the founder of Thrive Doctor, and he's going to be bridging the gap between the gym and doctor relationship. Yeah. Thank you.
Thank you. Hello, everyone. Thank you for coming bright and early. Never before have people spent so much time and money on their health, yet felt such an urgent need for more. In the age of self-driving cars, rockets that land themselves, and chatbots that surpass any human capability, we also, unfortunately, find ourselves in a culture of over-medication, over-medicalization, and peak preventable disease. At Thrive Doctor, we strongly believe that gyms have something that no phone app or pill ever will, and that's trust, habit, and regular human connection. And for this reason, we founded Thrive Doctor to bridge the gap between the fitness world and gyms and come together. This is a whopping $9 trillion industry, and it's growing at a rate of 25% year on year. So you can be an early leader and you will be disproportionately rewarded, or a reluctant follower. Early in my medical career, I used to work in A&Es, ITUs, and urgent care centres across the country. It's a difficult job, sometimes thankless, but I would say there are two key valuable things I was able to do. The first is to make sure there's no delay in life-saving treatment. And the second is to communicate with the patient and their wider family, make them feel reassured, make them feel like things aren't out of our control, even if truth be told, they so often are. I couldn't help but think the same thing over and over. No one plans to spend their Saturday afternoon in A&E having a heart attack. It always comes as a nasty surprise. These are usually from risk factors that were either unknown or unaddressed for years, and it doesn't have to be this way. I really believe that gyms are where prevention belongs, and a big part of a hospital doctor's role, once you clerk the patient, diagnose them, run your tests, is just to put them in a pre-written pharmaceutical algorithmic treatment lane. And I always thought, what a better thing to do, to work with gyms or in gyms and put people in prevention lanes. I'd much rather be doing this than putting them in a treatment lane in a resource bay. So that's what I've been doing for the last year and a half now. So it's becoming increasingly obvious to us that the golden triad, which is the structure with the client, the gym or PT, and the longevity doctor all working together, is the perfect structure for optimum health, and much better than our outdated model where there's no continuation, there's no communication, and no reliance on medication. So this is an example of an MDT. MDT stands for multidisciplinary team. So while we've been innovators in the Golden Triad, MDTs have been around for years before I was born across the healthcare system globally. And the idea is that in complex cases, rather than rely on one person with one brain from one school of thought, we get a team of specialists from different specialties to come together, create the best plan holistically for the patient with the best outcome. Make sure everything is considered, nothing is missed. You might be thinking, okay, MDTs sound good, but what's the value? So as an example, let's say there's someone who needs hip replacement. You've got the surgeon, performs the surgery. You've got the anaesthetist, whose job it is to basically make sure nothing crazy happens on the operating table. But you're missing a third person here in the MDT, and that's the physiotherapist. And arguably, they have the biggest role in determining whether that patient 6 months later thinks of that success as a failure or a success, that surgery. And in their role, very similar to the magic that you guys are doing in gyms, it's exercise selection, it's intelligent programming that's going to be easy to integrate into the patient's working week. And with these exercises, with these routines, you're bringing blood supply to the joint, you're bringing oxygen, you're bringing nutrients, you're helping the joint rejuvenate, recover. And as I said, this is the biggest impact on the patient. Also importantly, you're strengthening the right muscle groups. So, as doctors, we can request blood tests, we can request x-rays and MRIs, but far more important to me than any test could tell me is what's the patient's function, what's their mobility, what's their quality of life. So you might be thinking, okay, longevity, preventative care, do we need an MDT for this? Is it so complex? I would argue yes. We see it all the time. If it was easy, we wouldn't see such worrying health trends. I'm aware I'm in a room with gym owners and people with incredible physique. So I'm sure you guys have got your longevity protocols, how you eat, how you train, how you sleep, down to a T. What I would say is, as PTs or gym owners or coaches, you're certainly specialists in 2 of our 5 pillars of longevity, which is the second one, fighting sarcopenia, which is essentially adding muscle mass. And, people think of losing independence, it comes with age. No, it doesn't. It comes with losing muscle mass, sarcopenia. So you're specialists in this. And the third pillar is heart health, VO2 max, which is something that we test and we're very interested in progressing. So you guys can do that extremely well. In the context of the noisy gym floor, whether you're working one-on-one or in a wider class, it's going to be very difficult for you to also be looking at our first pillar, which is insulin sensitivity, hormone health. The other 4th pillar, I believe, is sleep. Not just getting higher quality sleep, but longer hours of sleep, which we know is so related to preventable disease. And the 5th one, well, I'm sure, I know that movement is medicine and is fantastic for your brain chemistry or mental health. To really dive deep on the gym floor into somebody's brain chemistry to optimize their mental health, their dopamine, their cortisol, it's a difficult ask. Somebody that is doing not the best job at all in these 5 pillars of longevity, unfortunately, is a modern day doctor in the context of their doctor's clinic. They're not trained, and I can say this firsthand, we are not trained in prevention of these 5 pillars. Big Pharma, unfortunately, is in medical schools, and a big part of our training, a big part of our examinations are which drug should be given in this context. You might also say that doctors aren't incentivized to dive deep into longevity, into prevention, in the context of you're in a doctor's office, you've got a patient with an acute problem, probably they're after something specific, you've got 10 minutes, you've got a prescription pad ready to go, and you've got a waiting room with 29 other people. So this is an AI-generated image of a gym owner who actually approached us for a B2B relationship. But I met up with him in person, trained at his gym with him, and he did look like this. He was an absolute phenom, doing weighted muscle ups, trying to improve my technique. And to get a taster of what we do, he wanted to kind of get a mini version. So we ran him through a metabolic assessment, just so he can kind of go through the motions and understand, so he could kind of market to his clientele. And interestingly, he was in his 30s, about 34, 35. As I said, in insane shape, absolute animal. And we found that he was pre-diabetic. So doing so much right, still there were gaps in his longevity protocol. And he was very grateful that we first highlighted this. And then we were able to kind of address the underlying issues, which for him was cortisol, and also his sleep was suboptimal. So he's very grateful that we were able to reverse this, especially as this wouldn't have been on his radar at all, and I wouldn't have thought it either. And he did have a family history of diabetes. So bringing a couple of case studies for patients that we had. This is a gentleman, again, AI generated, a gent in his 60s who previously loved the gym. When we met him, unfortunately, his well-meaning doctor, after a very non-specific, vague heart scare a year prior, told him pretty casually, almost like a throwaway comment that he never kind of dived into, you should wind down your rigorous exercise. So reluctantly, he gave in to his wife, cancelled his gym membership, and basically for the last year, he'd been rotting on the sofa, gaining weight, mental health deteriorating, blood pressure up, medication list being added to. So first things first, once I consulted with him, deemed him medically fit to be back in the gym. He was very happy, even spoke to his wife to convince her. He reinstated his PT, which she was fantastic, and we worked together for 3 months. And he was seeing her 3 times a week. And after the 3 months, we reduced his heart attack and stroke risk, which is a Q risk, by 42%. We reversed his diabetes, and we also did something else that I forgot. Safely stopped 6 out of 9 of his tablets. That's what I was most proud of. And this is what we're all about, reducing medication. And he was really happy about that. And he actually admitted afterwards that he'd only sporadically been taking his tablets. You might be thinking, okay, is this only for people that are medicated? This is a lady, Karen, who was captain of the women's golf team, health freak, listened to every health podcast going, did 20,000 steps a day, which is way more than I do most days. And she'd also done the Zoe Health Protocol with kind of mixed insights. A lot of people come to us saying, make sense of this, please. And on our first consultation, unfortunately, we found that despite all her efforts, and there were more than most, she'd bought into the common health myth, women shouldn't lift weights for fear of getting too bulky. As I said, she had listened to a lot of health podcasts, so that kind of had been debunked in the last year or so. But she was too afraid, because she took her golf so seriously, she was too afraid to kind of engage and act on that for fear of doing herself a shoulder or knee injury. Obvious things are obvious. I said, look, you're already a member of a gym, get a PT, kind of let them take you under their wing, get started. She pretty firmly told me, I'm not a gym person, I'm not a PT person. So I didn't give up, gave her a workout to do at home, which is not ideal because we work with clients typically over Zoom. I gave her a workout to do in her living room, body weight squats, push-ups against her sofa. You can obviously imagine, because she hadn't trained basically ever, within a few weeks, she's noticeably stronger, newbie gains, feeling amazing in herself. And then by week 4, she gave in to my not so gentle peer pressure, engaged with the PT who took her under her wing once a week, also invited her to a strength and resistance class once a week. Even better because there's a sense of community. I know there's a lot of CrossFitters here, which is wonderful for her longevity. And by the end of the time we worked together, she really understood and internalized, a chain is as strong as its weakest point, because she'd been doing the other 4 pillars so meticulously for so long, yet completely neglecting her muscle mass. This was where she would get her disproportionate gains. So she understood that of all of her efforts, and as I said, there were quite a lot of efforts on a daily basis, she realized this is where she should put most of her priority. Nobody got fired for buying IBM. This is a phrase from the financial markets back in the day. And the idea is essentially people were allocating money on behalf of their clients. Yes, they wanted and they're paid really to get the best return on investment for their clients. But actually, they were practicing defensively, investing in sensible things, IBM, that their peers and more importantly, their bosses couldn't criticize, couldn't fire them for. So essentially, they were acting mostly in the longevity of their own career. It's not the fault of any individual. It's a system, it's the structure, it's the way they're incentivized or de-incentivized. Unfortunately, this is just as true, perhaps even more so, in modern day medicine, and I've lived it. If your doctor, if you walk into your doctor's office with low mood for a few weeks, nobody is going to criticize that doctor for giving you a prescription of antidepressants. If someone walks into that doctor's office with borderline high blood pressure, nobody is going to criticize that doctor for giving a prescription for your blood pressure meds and buy one, get one free, here's your statin to go with it. And now we're in the age of Ozempic. More important than any doctor's opinion is, what does the pharmaceutical guidelines say? Can I give it? If so, there you go. So we are in the peak interest of the Ozempics, the semaglutides. Also, we are at the peak interest of what are the alternatives. People are getting fed up of taking the medication. They're aware of the side effects. They've never been so skeptical of Big Pharma, so they are seeking an alternative. This is a chart of antidepressant prescriptions. 1 in 6 adults in the UK now on one. As you can see, as time goes up, the chart's going up. And this could be a chart of anything. Next one is hospital admissions, heart attack hospital admissions. Next one is blood pressure medication prescriptions. So essentially, medications are going up, preventable disease is going up. And I can't stand that, and that's why we do what we do. So hopefully you buy into our ethos. Most gym owners, most gym goers do. You might be thinking, what are the benefits if you bring this to your gym? Because obviously you guys have come here investing your time and money in how you're going to grow your gym as a business. So I wouldn't be stood here before you if there wasn't huge upside, not just theoretical upside that we're seeing gyms enjoy. So the first thing is financial. This is for you guys as business owners, obviously the most important. Last night I was with Chris, the owner of Two Brain Business, title sponsors here, and he said that when gyms join him, around 25 to 30% of them are actually losing money, and many of them don't know. So we need to do something financially that makes sense. So essentially, you've got the ethos, you've got the idea. We want you to acquire more clients. We want your clients to stay with you for longer. And we want your clients to engage more often, more sessions, be more involved. We do this with medical credibility, with evidence-based, promote your services, talking about client retention. So frequently we get people that limit themselves just because they've hit an arbitrary number or an arbitrary age, or they've got a new diagnosis that does not discredit them from being an active member. But whether it's themselves, a friend, a spouse, or a well-intentioned doctor practicing defensive medicine, unfortunately, they cancel their membership prematurely. We think the opposite is beneficial. Just as when people so often they retire abruptly from their career and they aggressively decline, the same is true for when people cancel their membership. Staying an active member of a gym, a community is even better, that has all kinds of different benefits on top of it, is wonderful for longevity. So, we get lots of weird gadget companies asking us to promote this and that. Brian Johnson, all-time peak, one company asked us to promote their erection counter overnight. We don't want to do that. We're medical doctors, but I have no problem at all promoting what you guys do, and that's why we do what we do. Bringing client acquisition into it kind of ties into the reputation side of things. Something that our gym owners that we partner with really enjoy is bringing the feel of a team of in-house longevity doctors working with longevity team. It brings a reputation and helps you appeal to a different kind of audience. Obviously, everyone in the room is, a gym person. But remember, 84% of people in the UK are not gym members. So we need to appeal to them in a slightly different way. So sure, some of them never going to come, fine, forget it. Some of them are probably scared of the squat rack or just intimidated, or like Karen, not gym people. But if we can reel them in and get them addicted to being active and engaged members of what you do by coming from the longevity angle, living longer, living better, gym owners are finding they are appealing to a different kind of clientele. And the third advantage, which I know for you guys as business owners needs to come third, for us is what we're most focused on, is happier and healthier clientele. So you kind of get the idea of what we do: reducing medication, reducing heart attack and stroke risk, reducing dementia, reducing cancer risk, improving brain chemistry, mental health, reducing antidepressant reliance. So your members will be happier, they will be healthier, they're with metrics, we're data driven. So, not like any other doctors from traditional backgrounds, we are measuring VO2 max. We're very interested in grip strength. We're very interested in functional capacity, whether that's number of pull-ups, 1 rep max, 5 rep max, overall functional capacity. We're measuring this. So your clients will be happier, they will be healthier, they'll be stronger, and they'll have you to thank. So this is a new trend. It's growing aggressively, as I said, around 25% year on year. We've been doing this for a year and a half now. So we've spoken to lots of gym owners, CEOs from UAE, America, and Europe is a little bit behind, but still growing fast. So I'll give you a couple of models, how we've observed people capitalizing on this opportunity. And there are a couple of drawbacks to some of these models, and then we'll move on to some ways that we try to make it feel easy and take away some of the downsides. So the first is employing doctors. So this is probably reserved for people with a bit of a financial war chest and a big belief that they want to double down, go into this longevity medicine space. So what they're doing, they're employing doctors from traditional backgrounds, retraining, repurposing them away from the pharmaceutical guidelines, putting them in the gym environment. And this is beautiful because you're getting that triad we talked about, the client, the gym PT, and the longevity doctor all working together. That is the best structure. The downside is the cost. You've got to not just employ the doctors, but you've also got to invest in retraining them. And then the biggest thing that we've seen a lot of gym CEOs really afraid of, the big fear factor, and I understand why, is the medical liability. What do you do if your doctor employee makes a mistake and human error? Someone dies, something crazy happens, you're not going to sleep at night. These are career enders. I think as gym owners, most people are not ready to take on. So we'll talk about how we work in a model where you don't have to even think about that. Medical liability, I don't think, should be on your list to worry things about. Second model we've seen, and this kind of ties into the medical liability side of things, is where people, gyms are really, they understand the opportunity, they see the demand for longevity services, something a little bit more. So they invest in equipment. You're thinking your red light therapies, your hyperbaric chambers, your sweat analysis. So they're providing a little bit more. There is an appetite for this, and they're just completely foregoing any kind of medical practitioner, so they don't have to worry at night. So this is good in that, yes, you are providing something more, maybe appealing to a slightly different audience, maybe you're able to upsell a little bit more. The downside is it's an incomplete triad, and you're essentially investing in equipment. You know, we're not against using these equipments and these niche tests, and we work with gyms that do have some of these. We can promote some of them with evidence base, but really you're essentially investing in equipment or services that you don't necessarily know how well they're going to be uptaken. And if something is very popular, it's quite easy for a rival gym down the road, just copy and paste a model. So we work with gyms in a few ways, and our whole idea, our whole ethos, is that we want to magnify your impact, take on any medical liability, any concern. That's not your role, I don't think, and also make it very low or no friction. So we're a small team of 4 longevity doctors, so we can work flexibly, and a few different gyms ask us quite niche, bespoke ways, but I'll give you a few templates which are proven popular. So the first is with an in-person longevity masterclass. Essentially, this is a 1-hour event where the team of us doctors will come to your venue. We dive into the 5 pillars of longevity that we touched on earlier. Very importantly, give your audience instant actionable strategies. No use being theoretical, throwing a medical textbook at someone. So they leave the door, instant actionable strategies across the 5 pillars. We get to know what kind of services that your specific gym has. We bring on medical credibility, using evidence to promote your services and why it's a good thing to stay a member of your gym and why it's a good thing to be more active, more engaged. And maybe gives people, reinvigorates people's ideas on how to use your current offerings. So as an example, in addition, we also have a revenue share model. So the way we work with patients is, as I said, remotely on Zoom, but it's either one-to-one or in small groups in paid 3-month programs. So any gym that refers us patients, including from the longevity masterclass, we do a revenue share model. So as an example, a couple of months ago, we went to a gym, quite an exclusive little space. They had an audience of 8, and they all gave great feedback because it is a good talk. But then 4 of them actually enrolled in our paid programs. So we were able to give that gym owner £1,200. Literally all they did was switch the light on for an hour. And more importantly than that, the gym owner, because we like to stay in touch, he told me a few weeks later that he'd noticed that that specific audience that came were more engaged. They did come for more sessions. And, you know, there's a good benefit. This is especially popular for people that, you know, are maybe a little bit disillusioned, not necessarily seeing results, and they just need not necessarily more motivation, but slightly different angle of and different insights. Second way we work together, which is proven popular, is with bolt-on memberships. So the idea here is that you get the feeling of in-house longevity doctor team. Different gyms call it different things, but essentially you create a different tier of your membership. Included in this is a longevity doctor consult, so whether that's every month or every quarter, and we can do specific tests, some that we recommend, like live biometrics, live sugar monitoring, or basically whatever the client or the gym wants us to do. And this is integrated nicely. The beautiful thing about this is it does give you the triad. But as I said, I can't stress this enough. I don't want you guys to be worrying about medical liability. So we take that on. Anything medical, we put the cost and the liability, and we kind of get on with that. But then with the patient's consent, we kind of can bridge that gap and make a holistic plan. Thinking about, comparing it to a salon, for example, where a lot of gyms have, they rent out the space, an additional revenue stream. This is a way that you can get an additional revenue stream, elevate your reputation, and you don't even have to have a space. So a lot of gyms just literally have a poster up. We're now working with longevity doctors, scan to find out more. Very, very low effort. There's even one gym where there was a couple, a husband and wife, that joined us through the bolt-on membership. They moved geographically, so they had to quit a gym membership, but because we've met them through that gym continues to get recurring revenue for clients that don't exist in them anymore. The final way that we can work together is with upskilling your PTs, giving them longevity doctor accredited packages that you can then market quite well to your clientele. And it brings, like I said, a different kind of reputation. You're at a slightly different offering, perhaps at a premium price offering. And again, that's proven quite popular. And again, in terms of medical liability, we would be kind of your safety net anytime you need to touch base with us. But it's a good way to upskill and increase your offerings. So I hope this talk has inspired you to think about longevity. You're already smashing two of the pillars. Lean into this. Don't be a reluctant follower. Lead this, and you will be disproportionately rewarded. If you'd like to have a chat with us afterwards, a team of us 4 doctors will have a stand here that we're going to race to because no one's there right now. You can also email or scan the QR code. And I'll leave you with a quote from a gym owner that we've been working with for a year. So he really understands the value that we bring. It's a total no-brainer. Why wouldn't I want to host a team of longevity doctors that are going to promote my services, bring value to my clients for free, giving me a new revenue stream for a service that I don't want to provide? Thank you. Any questions at all? Yep. Oh, nice.
Finding the patients, for example, like you said, that some of them are told to steer away from any form of exercise. How have they got into you?
Yeah, so we prefer to work with gyms and golf clubs, but we also in local communities. And we also do talks at golf clubs, that's where we get a lot of people coming to us directly. So we do talks at golf clubs where they invite non-members. Even when we go to gyms, it's a great way to invite and kind of show off your services to local businesses or non-members. So people kind of, it's a good way to kind of network. Be very interested to chat to you after. Yep.
In terms of what we can do from a gym perspective, benchmarking in terms of you've got a sarcopenia perspective on the 5 exam and VO2 max.
Yep.
Is there anything that can be used to benchmark that in the actual gym to say, like, this is where you're on, this is where you go?
Yeah, absolutely. I think, I love the gym environment, but I think for a lot of people, it can feel aimless. So I think giving them metrics, giving them things to progress in is really valuable, and different brains are different people think differently, but definitely giving them key metrics to focus on, and ideally the right metrics. So I think like VO2 max is the single best predictor of longevity. So it's a fantastic one. And there's also, we're working with an app. They have a pattern. I don't know if it'll hold because it sounds too good to be true, but we use it where they, with your smartphone and your camera, you can estimate your VO2 max. Thank you.